So the first thing I'll be doing is verifying the order and hospital policy and on the chart, and then I'll position my trash can, perform hand hygiene, and put my goggles on. Then I'll identify the patient. So Jaguar Jones, MR number 4176352, MR number 4176352. Allergies are penicillin and penicillin, and then I would ask if there are any other allergies that I need to know about, and some indications for indwelling catheter are to assist in healing of open sacral or perineal wounds in incontinent patients, acute ventilator dependent respiratory failure, or acute worsening of mental status. And then I would raise the bed to a working height and lower the side rail, but I'm well aware that my workspace is well below my waist today. And then I would position the patient in a dorsal recumbent position with their legs slightly bent, and then I would explain the procedure to the patient. So today I'm going to be doing an indwelling catheter. And then I would perform pericare. So I would start on the outer labia farthest from me and go from front to back. And then I would do the outer labia closest to me. And then I would go down the middle, front to back, and all those. And for male pericare, I would grasp the shaft of the penis, and starting at the meatus, I would go in circular motions outward. So now I'm going to my kid. Then I'm going to don my sterile gloves. Now I would put my lube in the container and dispose of the packet, and then I would lubricate the tubing. For a female, I would lubricate 1 to 2 inches, and for a male, I would lubricate 5 to 7 inches. And then I would attach set this to the side. Now I'll be cleaning. And now I'm going to be inserting the catheter. So I would ask the patient to bear down. And I'll be inserting it until I see urine return. And then once I see urine return, I'll insert it another 1 to 2 inches. If I had been cleaning a male prior to this, I would have started at the I would have grasped the shaft of the penis, and starting at the meatus, I would have gone in circles outward. And if I had for inserting the catheter, I would once I saw urine return, I would insert it all the way to the bifurcation. So now I can grasp the catheter, and I'll be inflating the balloon. Now I'm going to slightly pull back until I feel resistance, and then push it back in. And now I'll be getting my stat lock, and it would be applied to the top of the patient's thigh to prevent urethral trauma. So to remove the catheter from the stat lock, that is what I would do. And I would now attach the drainage bag to the bed frame, not the bed rail, but today I'll be attaching it to my handy dandy chair. And now I would dispose of all of my supplies, and I would lower the bed to the lowest position and raise the side rail, and make sure the patient was comfortable and had her call light and comfort equipment. And now I'll be going to collect my specimen. Then I would label the container and send it to the lab. And for a collection up here, I would have my container ready, and I would not be getting my syringe out of the trash. So then I would attach the syringe to the port after cleaning the port with an alcohol wipe and waiting for it to dry. And then I would draw back 10 milliliters of urine and remove that. And I also would have clamped the tubing before that. And then I would put this into the collection cup, dispose of the syringe, and close the cup, label it, and send it to the lab. So after this, I would dispose of my sterile gloves. And perform hand hygiene. And then I would go and document. So I would document the size of the catheter, the amount, color, and consistency of the urine, the specimen collection, how well the patient tolerated the procedure, and I would remove I would make sure the catheter is removed as soon as medically indicated, and I would do daily catheter care on the patient with soap and water. So to remove the catheter, I would first put on my clean gloves. Then I would I would measure the amount of urine in the drainage bag and empty it into a graduated cylinder. And then I would get my syringe and deflate the balloon. Before doing this, I would have loosened up the syringe and gotten 0.5 milliliter of air in it. Now I would dispose of this. So now I can remove the catheter and dispose of it. And now I would perform perineal care again and remove my clean gloves, and I would go to document. Well, I would make sure the patient was in the comfortable position with their colli and comfort equipment, and then I would go and document after performing hand hygiene. So I would document the intactness of the catheter tip, the amount of water drawn from the balloon, the color, amount, and consistency and odor of the urine, and how the patient tolerated the procedure. And then I would give the patient teaching on the symptoms of UTIs, which could be urgency, frequency, or pain or burning while during urination. And then I would make sure to come back in 4 to 6 hours and see if the patient has urinated, and if they haven't, then I would palpate the bladder and or do a bladder scan.